So we're going to talk about two sources. One is root canals, and the other is areas where you've had teeth removed previously. And a lot of people will say, well, I've never had a tooth out. I'll say, well, do you have your wisdom teeth still? Oh,
Right.
no, I got those out.
Yep.
That's what I'm talking about. So a large majority of people have had wisdom teeth out. These infections are hidden. The problem with that is you don't really know that anything's going on. And there is research, crazy research, showing things like infection in the mouth, whether it be gum infection, root canals, or where your teeth were removed. Those infections will kill you. Like 78% of clots that killed people either from a heart attack or a stroke had mouth-only bugs in them. I have yet to find a person with cancer or has had or has cancer that doesn't have an infected root canal or an infection in the jawbone where a tooth was removed. I've not found one yet. I've not found one yet. There's zero. In fact, I was told this by another.
Welcome to the Deconstructing Conventional podcast. This interview is brought to you by Healing United, a private membership association committed to helping you reclaim sovereignty over your health, life, and future. You could say our tagline is question everything and rebuild intentionally. In the audio format of the show, there's additional commentary before each episode, and there are also over a dozen audio-only episodes. You can find the show anywhere you listen to podcasts, including the Healing United PMA app. Look for it in the App Store. And if you want to learn more about the work we do, and especially how we help people heal when the doctors have no answers, visit us online at healingunited.today. Now, on with the show. All right. Hello, everyone. Welcome to today's show. My guest is the lovely Dr. Michelle Jorgensen. She is a functional integrative dentist, a board-certified traditional naturopath. She's also received certifications as a therapeutic nutritional counselor and a certified nutritional autoimmune specialist. She also has an amazing line of dental products, which we'll talk about in a little bit. She is the author of 6 books, including the one where I first came across her work called Healthy Mouth, Healthy You. And she has a new book coming out next week, May 20th, called Living Well with Dr. Michelle. And just to give you a sense of the baller that is Dr. Jorgensen, she also teaches and coaches healthcare professionals, like not surprisingly dentists, but also chiropractors, naturopaths, medical doctors, nurse practitioners, nutritionists, massage therapists, and coaches like me about a truly integrated model for what I would call real healthcare. A major inflection point in her life, or her professional career, was 10 years into practicing dentistry. She became quite sick and realized that the cause of her illness was from exposure to mercury from drilling metal fillings out of people's teeth without proper protection. So we'll get into that story in just a little bit. She's also become quite the homesteader and gardener and offers classes to learn for other people to learn to do the same. She's a wife and mother of 4. She claims to be a grandmother, which I don't think she doesn't look old enough to be a grandmother, so I'm skeptical about that one. But anyway, Dr. Jorgensen, thank you so much for taking the time to join me today.
Thank you. I'm glad to be here. And I am a grandmother of 2, my
Okay.
favorite 2 little humans on the planet.
Okay, so it's confirmed. We want some video or visual evidence of this, but I'll take your word for it. So thank you for coming. All right. Well, there's so many things about you that fascinate me. So I told you before we started, I limited myself to one of your books, but give the listener a brief background about yourself, what led you into dentistry, and then talk about the journey of becoming a biological dentist and then eventually a naturopath.
Yeah. So to get to dentistry was a pretty easy thing for me. My father was a dentist. My grandfather was a doctor. And actually, I had an interesting experience when I was a senior in high school. I knew I wanted to do some sort of medicine. And what I did is for a project for school, I went and interviewed every doctor in my neighborhood or every doctor I knew. And I interviewed every dentist I knew, and I asked them all, should I be a doctor or should I be a dentist? All the doctors said be a dentist. All the dentists said be a dentist. I said, well, consensus seems to be a dentist. So that's what I did. I started right off school, and actually I moved quite quickly through school, graduated when I was 23 years old from dental school. So I've been doing this a really long time.
Wow.
Yep.
That's
So it was an early start for me.
Well, I'm fascinated why all the doctors told you to become a dentist. What was their rationale?
They just said from quality of life standpoint,
Huh.
there's no rounds in the middle of the night. There's no,
Ah,
things like that going on. So if I wanted to be a mom, which I did, they said from a quality of life standpoint, your dad has a better life than we do.
oh,
So go be a
there
dentist.
you go. Okay. Well, talk to us about the journey of becoming ill from mercury. Like, how did you connect the dots that that's what was happening to you, and what were your symptoms?
That was not as easy as my decision to become a dentist. That
Okay.
one was a lot harder. I was watching my dad. We were actually practicing together, and he's still practicing in his mid 70s.
Wow.
And I just thought that that's what I would do, that I would just keep practicing forever, and everything would just go along like it had for him. And I was enjoying practice. And about 10 years in, I started to get really sick, and I didn't know what it was. So I started doing what we all do, going to doctor after doctor and doing things that I could, like changing my diet and, the things you do, like everybody does at home. You stop eating certain stuff and whatever. And
Yeah.
some of it helped a little bit, but the doctors didn't have any answers. And I was doing tests and x-rays and still no answers. And my biggest issues were my gut. I couldn't even drink water sometimes without pain. So something was pretty off there. My memory was just shot, and I've always had a good memory. I couldn't complete sentences. I couldn't
Mm.
remember patients' names from room to room. So again, something was pretty noticeably off there. And then the third one was just really bad, painful numbness in my hands. I couldn't sleep at night. I couldn't blow dry my hair. I couldn't hold my dental instruments anymore. So it got to
Yeah.
the point where I just actually put my practice for sale. I didn't know what I was going to do. I was a young mom of 4 young kids, mid 30s. My husband worked for the practice as well. So this was our entire livelihood going up in smoke right here. And nobody could give me any answers. And I thought, well, I'm interested in nutrition now that I've been working on my gut health and diet. So maybe I'll be a nutritionist in a dental office. So I found a dentist that had a nutritionist in his office. And I just said, could I call and talk with you? How does this work? I called and talked with him and he said, your symptoms sound a lot like mine. Have you looked into mercury poisoning as a possibility? And I said, well, no, I don't have any mercury fillings in my mouth because I knew that silver fillings have 50% mercury. We were taught that in dental school.
Hmm.
But I was also taught they're perfectly safe. And so, and I said, no, I don't have any fillings. And they're safe anyway. And he said, well, first of all, is it, maybe it's worth just getting tested to be sure. And he said, it's not the fillings you have, it's the fillings you've been drilling out for the last decade with no protection. And that was literally the first time I'd ever heard those words. So
Mhm.
I got tested for mercury poisoning, and that's what it was. Mercury off the charts. So now all of my neurologic symptoms made sense because mercury is a neurotoxin. So it was affecting my brain and my thinking. It was affecting my hands and all the nerves there. It was affecting my gut, which is very much nervous, gut brain connection there. And all of a sudden, everything made sense. But I didn't know what I was going to do. The doctor said, well, if you're going to keep being a dentist, you can't keep putting it in while you're getting it out. You're not going
Mm.
to get better if you keep just dosing yourself every single day again. So I had to find, was there a way to remove these fillings and not get more mercury in me? And I found there was an organization I had never heard of before who had protocol for this. It's called the IAOMT, and they had their SMART protocol, which was an entire list of things you could do so that you didn't get exposed to mercury during removal. I had never heard of them before, never heard of these protocols. So I started doing all of this because basically in dental school, I had been told if I told my patients that their fillings could affect their health, I would lose my license. So that was the only information I had about mercury was that it won't, and you'll lose your license if you say it does. So I had never ventured down these paths. These weren't like safe paths. So,
Right.
but now I had to. So I started going down that path, and I would walk into the operatory now to, remove fillings with a hazmat suit on and a gas mask. And my patients would say, excuse me?
What's going on here? Yeah.
What's going on here? This is a little different than last time I came in. And so I would explain the story and I'd say, this is for me. And they would say, well, but isn't this probably good for me too? Yes, it is. Well, my mom might be interested in that. She's actually been feeling really sick, and maybe, or my doctor would be interested in that. She's kind of getting into this kind of stuff. So then patients and doctors started asking me things like, well, what are your thoughts about, fluoride? Do you still believe it's the best for you? And what do you think about root canals? And I said, well, I've done, like 1,000 of them. Well, what do you think about them? Are they healthy long term? And these questions from people outside of the industry made me stop and say, wow, if I didn't even know that I could get sick from doing my job, what else in my job could be impacting not only my health, but all of my patients' health? And that opened an entirely new door that I never intended to go through. And now we have a multi-specialty, multi-doctor office campus, really, where people come from around the world to improve their health. And it's all based on the foundation that mouth health affects overall health. In fact, 60 to 80% of chronic disease can be traced back to your mouth in some way. So that is the very short story of a very long journey to get where I am today.
Wow, that is well said, very succinct. And I guess I'd say a few questions now. What percentage of the people that are trained as a dentist actually know what you know? Is it fine? Are they finally teaching this, or is that still you're not allowed to talk about this with most dentistry training today?
Oh no, you'll never hear this in a school ever.
Jeez.
Yeah, and schools are always, I mean, in any profession, it doesn't matter where you're at, schools are always about 10 to 15 years behind the actual profession, behind advancements in the profession. Schools are that far behind. So it doesn't matter if you're going to medical school, wherever, you're going to be 10 to 15 years behind really where the front runners in the profession are. That's just the way it is. It's just a slow evolution. So my whole emphasis now is teaching people like your listeners.
Hmm.
Because if they know what they should be looking for in a dentist, then they'll start to go and ask it of dentists. And dentists will have to say, well, okay, I had literally 5 people this week come in and ask me about this. I guess I can go see what this crazy talk stuff is all about. And then they can go and they'll seek out, either my courses or other courses and start to learn. Because from inside the profession, I mean, we're probably 1, 2% at most. And dentists are not interested in hearing what I have to say.
Wow. Well,
So,
and you didn't lose your license. You're still here and you're still able to talk about these things. And so obviously there's a way forward for that. So
yes.
anybody listening to this, take heart that you don't have to be under the thumb of we will take away your ability to transact and feed your family if
No,
you talk
no.
about truth. So
Yeah,
no, that,
research is on the very front end. So research is even ahead of practitioners and practitioners are ahead of schooling. So research has now proven everything that I say.
mhm.
That mercury is released from fillings 24/7, that you can get mercury toxicity from the vapors coming out of a mercury. Like I can say all of that now because now we have research that's actually proven all of that. But when I was starting this 15 years ago, we didn't have that, but we do now.
Great. Well, thank you for having the boldness to speak up, and I look forward to unpacking more of that as we go. But before I get there, what did you do to overcome your own mercury poisoning? How did you get that out of your body and get rid of the symptoms you were dealing with?
Yeah, that's when I had to learn a lot of other things too. I had to learn that first of all, there's different kinds of mercury. There's the kind of mercury that's in fillings, and there's the kind of mercury that you're going to find in fish and vaccines, and they're actually different mercuries. There's
Mm,
elemental mercury and anyway, different versions of mercury. And so the kind of mercury that I had from fillings actually excretes through kidneys. So what does that mean? It means my kidneys needed to be healthy. My whole entire, urinary system needed to be healthy. So I had to get that working to be able to get rid of it.
mm,
I had to figure out where the mercury was hiding because mercury just goes and hides in, I call it neighborhoods. It just goes, hangs out and it's, behind the shed back there. And you gotta, use your searchlight and get it out. And so you have to use something called a chelator to pull it out to then be able to excrete it. So kidneys working first, then I had to start using chelators, and I found real quickly I could not use very intense ones.
mm.
So I was using things like cytodetox, a bunch of different others, and I got sick as sick. I
Really?
mean, literally, I got down to like 110 pounds. I was so ill. My mom said, "You look like a walking skeleton. Like, what is wrong with you?" I'm like, I can't eat a bite. I'm so ill. And so I just said, I cannot try to get it out of my body this fast. I can't
Mm,
do this. I'm not gonna survive this. So I had to slow way down. And I've since learned. So what I started using was a lot of chlorella and just plant foods. Green foods have a lot of chlorophyll in it, which is also a very good, just gentle, natural detoxer. So things like lettuce and spinach and arugula and bok choy and those kind of green foods. But I found that I actually have a genetic variant that doesn't allow my body to get rid of toxins very easily. And you may talk about this. I'm sure you probably, it's called MTHFR. I
mhm.
got one from my dad, one from my mom. So my dad was fine, because he didn't have both. I got both of them, and I don't label toxins very well. So
Huh.
I like to think of it like a UPC code on, it comes into the body, your body goes, ah, bad, get rid of that one. Oh, good, keep that one. My body doesn't label things very well. So I couldn't get rid of the mercury. And on top of that, I've since learned that women who are expecting a baby detox about 80% of their mercury into their first baby. And
Oh,
guess what I was
man.
in birth order?
First.
Number one. And my
Wow.
mom had a mouthful of mercury fillings. So
Wow.
I think I probably had a mercury burden from birth.
Hmm.
And then I had the genetic inability to get rid of it. And then I started adding it. And, I started working in my dad's dental practice when I was like 14. So I started adding it early on and then went to dental school. And I think by that point, like it was just, game over for me. So because I think it was over a lot of years getting in, I had to take a lot of years to get it out. So I was
Hmm.
doing slow chelation, slow detoxing for about 8 years before I really felt like my brain was back.
Wow. Well, that is more of an involved story than I was expecting. That's quite a journey. And for somebody who's been through what you've been through to think 8 years, I might be at this detox thing a while. There's a recalibration that goes with that to find your path to detox. That's Good, helpful intel. Thank you for sharing that. Before we get to some of the particulars of the dental industry, I guess I just wanted to humanize this a little bit more. To tell us, if you will, like the emotional side of what you learned, because you basically had to come to terms with like being part of an industry that was causing major amounts of harm in millions of people, and more or less reinvent yourself while being threatened you'd lose your license if you spoke out. So, what was it like emotionally going from traditional dentist to biological or holistic dentist?
It was really hard, particularly because my father is very much traditionally, we were both traditionally trained.
Hmm.
And so there was a lot of mistrust, a lot of even making fun of, of these principles, it just even internally. And so we were practicing together when all this started. And that was very difficult to say, I don't really have a choice here. So
Mm.
I know you don't believe what I'm doing, and I know you're even making fun of what I'm doing here. And the team's watching you. So this is really hard because
Wow.
they also need to do what I tell them to do here. So that was certainly challenging. And I had to just decide what was the most important thing here. Was
Mm.
it my own pride, my own, all of these things, my own, you know, version of me, or was it the truth, what I was finding? And I've always been one that I've been underestimated pretty
Mm.
much my entire career, going into dental school, I was, one of a very few at the time. It's now 50-50 in dental school, but at 50-50 male, female students, but not when I was there. We were very much the underdog, and they all said, well, the only reason you're here is because they have, status. They need a certain amount of women in the class. They have to have a certain amount of women in the class. So
Mm.
I was very used to these underestimations, and I said, just watch me. And basically that's what I've done the entire time with this as well, as you know what, I'm not here to change your mind or to preach to you or do anything like that. And that's really how I've navigated this. I've just said, you know what, just watch me.
Mm.
Just watch me. And if you see me getting better, and if you see me helping people to get better as well and changing lives, then you can choose to believe and to be on board as well. If you don't want to and that doesn't fit for you, then, you are absolutely, able to have your own beliefs and your own belief systems, but I'm going to do what I believe is right for me. And I really had to also come to realization that I don't have to save everyone, and I
Mm.
can't,
Yeah.
but I can do what I can do because as I started learning, I wanted to share with everybody. I started buying everybody blenders so they could make smoothies and, all this stuff, and buying them recipe books, and so excited, and listen to this podcast and listen, read this book, and nobody did it. And I was
Mm.
really offended at for a while. And then I realized, what, we're all on our own journey.
Yeah.
So I learned if somebody asks me a question about what I'm doing, I answer the question. If they ask me another question, I answer that question. But I let people take their own pace, their own path. And that really was a thing that I had to figure out emotionally as well, is it's okay. I'm doing this for me, for those that I'm going to influence. And if people want to follow, I'm here for them. But I can't make anybody do what they don't want to do.
Yeah, that my admiration for you just went up. I resonated with a lot of that over 20 years as a health coach. I've had to come to terms with I can lead them to the water, but I can't make them drink. And the best I can do is show up and answer the questions or ask them thoughtful ones and get them thinking. It sounds like very similar path to you. And another thing I admire is just the guts to do it while you're still talking or while you're still in the profession. Because I know of other dentist people who've retired and we'll talk about, yeah, this is where my industry is not helping, but to do it while you're still in practice and to take some of those arrows or to have awkward moments with your own dad in practice. There's some guts and resilience in there. So well done. That's awesome.
I have an interesting story actually about that. So
Yeah.
I had been taking a really long continuum, a continuing education continuum. So it was 9 sessions, and each of these sessions was about $6,000. So you can start doing your math, adding this up,
Wow.
okay? And each one was a 3-day session. So I had to travel to Seattle, time away from work, the cost of travel, plus the cost of the thing there. So I was at the end of the 9 sessions and the last day. So you can see everybody that is at the table with me would have committed a lot, right? These are the top
Yeah.
of the top in the dental profession, the people who have really committed their time and their money and their everything to becoming the best. So I was at lunch on the very last day, surrounded by, these other dentists that had gone through the same process. And someone at the table started saying, oh, yeah, there's this crazy dentist in my office who wears like this hazmat suit when he's taking out mercury fillings. And the whole table started laughing. So I sat there and I thought, do I say something? Do I not say something? And I always say something. So, so
There we
I,
go. Yeah.
I spoke up and I just said, you know what? Can I share my story with you? And then I shared my story. The same story that I shared with you just now, I shared my story. And of course, they were all very embarrassed and very apologetic. And I said, that is not why I shared my story. I shared my story because if I can save one of you from going down the path that I went down, that will be worth it. That's worth all of it if I can save one of you from that exact same path. And what I've learned is that no one can dispute your story
Mm,
because it's your own.
yeah.
They can dispute a statistic. They can dispute an anecdotal story of someone else that you share. They can dispute all of that, but they can't tell you that your story and your journey is wrong. So lean on your story, those of you who are listening. Lean on your journey and stay there.
Mm.
And anyone who wants to follow you and learn more from you will come to you. And I hope that the people that were at that table that day have made some changes for their own health's sake. But it's just all about sharing your story.
Oh, it is. I can just feel it. Well, I imagine being in that room and the way that you navigated that. I love that you started it with permission to tell your story. You asked a question first, and you got the permission to, okay, well, and a story, like you said, nobody's going to dispute that. But yeah, there was a conviction in you that I can't be quiet about this in a room full of these people. And yeah, who knows how many lives you saved or will save just because you're talking to me today. So well done. I love that. Okay, well, you mentioned earlier the statistic. You estimated 60 to 80% of health problems start in the mouth. So give the listener some context for those percentages. How could the number possibly be that big?
Yep. So a lot of chronic disease, most chronic disease is inflammatory based, right? I'm
Right?
sure you talk about this all the time. You know,
Yes.
it's inflammation and inflammation. I've heard it phrased inflammaging. You know,
Mm,
basically aging is simply inflammation. It's the body's own response to something in the world. And you talk about this all the time, you know, with toxins and
mhm,
cleaning things up. And so the body's response to any sort of insult is going to be inflammation. It's the way our bodies are programmed to fight for us, right? It's our own
mhm.
body's
Yeah.
job to take care of ourselves. So our cells are super good at it, and it turns on inflammation. But if it can never get away from that inflammatory burden, then the inflammation never turns off. Well, there's three biggies inside of dentistry that can lead to that chronic inflammation that a lot of people aren't familiar with. So the first one is the mercury, like I just talked about.
Mhm,
Mercury is very inflammatory. So if you're going to get mercury fillings removed, please only do it if you're going to do it safely. Because if you go to just any dentist and they're going to drill it out, you're going to breathe it in, you're going to swallow chunks, you're just going to get more mercury in your system, you're going to be more inflamed. So
mhm.
make sure you're going to the IAOMT.org directory, or I have a directory on my site, livingwellwithdrmichelle.com. Go on that site, go find a dentist who's been trained to do that. So that's number one. I won't spend a ton of time on that because it's pretty cut and dry. Do you have the fillings or do you not? Get them out safely.
Can I ask you one thing you pointed out in your book that I thought was profound? I'm like, how did I not see this before? You talked about temperature changes and you talked about frequency related to mercury. So talk about those quickly for the listener so they have a sense of, oh yeah, of course that would be impactful.
Yep. So very interesting. If you think about if you have a jar of jam at your house that has a metal lid on it and you can't get the metal lid off, what do? You go put it under hot water. Why? Because heat expands metal. So then it expands and it comes off, it loosens the metal lid on that jar. So when you have a metal filling with heat, it expands the metal. With cold, it shrinks the metal. So it has this expansion contraction going on inside of the tooth at all times. What does this do? Well, it actually cracks the tooth. So I started telling people about the mercury fillings years before. I mean, why was I removing mercury fillings and got sick? You know, why were they coming out? Well, because they crack your teeth. They're really actually bad for your teeth themselves. So that's why I was removing them long before I knew that mercury was the problem, because they actually are really bad for your teeth. They just crack your teeth. So that's reason alone to get the filling out, just to preserve your tooth and save your tooth.
Hmm.
Frequency is another piece that's super interesting. And this isn't just the metal fillings, it's also metal implants. This is the place that really it was found, because that's another source of metal in the body, is metal dental implants. So this one's an interesting one. This information came out of research in the orthopedic world. So hips, shoulders, knees. I mean, how many metal parts are we putting in people's bodies every single day? Thousands of them, right?
Right.
And in the orthopedic world, what they found is that our world has changed. We are now surrounded by frequencies. So that's Wi-Fi, cellular frequencies, all of those kinds of things. Well, frequencies are simply a wave. And the one that people understand the best is a microwave, right? You put a
Mhm.
metal pan in a microwave, and what does it do? It starts to spark. If you've never done this accidentally, don't try it. It starts to spark. It can start your microwave on fire because those microwaves, those frequency of electrons passing through the air, they pass through the metal and they heat the metal up. That's why you can't put aluminum foil wrapped, baking potato in the microwave because it won't get through the metal. It heats up the metal, but it won't get through it. The same thing happens with metals in your mouth and other frequencies called Wi-Fi, cellular. They are all frequencies of electrons moving through the air like this. And when they pass through the metals, they heat them up. So now, because we have so much Wi-Fi, so much everything they're finding in orthopedics, that heating of the metal is literally burning or kind of killing off the bone surrounding these metal implanted parts and pieces. So they're seeing higher rates of failures because of these frequencies. And we simply can't get away from it. We opened a new office on our campus, and I told my husband, I said, I don't want Wi-Fi in here. And he said, pull out your phone right now. I want you to go onto Wi-Fi right now and tell me how many Wi-Fi networks pop up. He's like, it
Mhm.
doesn't matter if we have our own Wi-Fi router. He said, you're literally getting 50 different routers right here as it is. So
Mhm.
there was no way other than simply doing Faraday cages around our entire building and blocking off all EMFs. I do some of those things in my bedroom, but at other places, but we're just surrounded by it on a daily basis. So it's heating up the metals, which then destroys the bone. So in our practice, we don't do titanium dental implants. Like 1% of the time, maybe we do ceramic dental implants because they don't conduct electricity and they don't heat up. And there's actually been an increase in dental implants that have failed.
Mhm.
And people think they blame it on gum disease. They blame it on you're just not brushing your teeth. And what do I blame it on? Frequencies.
Yeah.
Smell to the
Man.
bone.
No, it makes so much sense. I'd never thought of it. Like mercury is what we use in thermometers, and it's super sensitive to temperature. So a
That's
hot
how
drink, a
it
cold
works.
drink, like duh, like how did I not put that together before? Yeah, but that's such an important point to make. If somebody has those, you're whittling away at the integrity of your tooth.
Yep.
Okay, so I interrupted you. Your first big one was mercury fillings or mercury
Yep.
in fillings. What's the second one?
Second one's a real biggie. It's hidden infections. And this is the one that leads to so much inflammation in the body. And I mean, there's research that shows that. So we're going to talk about two sources. One is root canals, and the other is areas where you've had teeth removed previously. And a lot of people will say, well, I've never had a tooth out. I'll say, well, do you have your wisdom teeth still? Oh,
Right.
no, I got those out. Yep.
Yep.
That's what I'm talking about. So, a large majority of people have had wisdom teeth out, and these infections are hidden. And the problem with that is you don't really know that anything's going on. And there is research, crazy research, showing things like infection in the mouth, whether it be gum infection, root canals, or where your teeth were removed. Those infections will kill you. Like 78% of clots that killed people either from a heart attack or a stroke had mouth only bugs in them.
Wow.
Yeah, it's enormous the amount of things. I have yet to find a person with cancer or has had or has cancer that doesn't have an infected root canal or an infection in the jawbone where a tooth was removed. I've not found one yet.
Let that sink in for a second there to the listeners. None.
I've I've not found one yet. There's zero. In fact, I was told this by another practitioner years ago, and she said, if you can find one, I'll pay $1,000. So I've been looking hard. Like I want my $1,000.
Right. Dang.
And I
No.
have yet to find one. So let's talk about why. What is the connection here? And it's it's kind of interesting because I have three brothers who are also I have two brothers that are orthodontists and another brother who's an oral surgeon. And they are on other dental forums
Hmm.
that are not the forums that I'm on. Well, now I've made way onto their forums, but they ridicule me greatly. My
Hmm.
brothers don't, the other people on the forums, but they tell me they're like, "Oh, you were on our forum again today. Guess what I heard this time?" But it was a forum that had a bunch of endodontists, people that do root canals.
Huh.
And the guy was complaining and saying, "How are we supposed to make money anymore because all these crazy people on the internet are telling people that root canals can lead to cancer?" So this was on this forum. I'm like, I have arrived.
Right. Congratulations.
Yes, I have now arrived. Anyway, so let's talk about this. It's all about the anatomy of a tooth. So inside of a tooth, there's a main canal. This is called the root canal. Have you heard the word root canal before? The
Mhm.
root canal, the canal inside of the root, it's like a 6-lane superhighway. Okay, it's where all the nutrients come in and out. It's where all the nerves come in and out of the tooth. From that superhighway, there's little exits. that go off into all the other areas of the tooth, all the way up and down the tooth. That's why when you tap on your tooth, you can feel it
Mhm.
because there's a nerve channel, a little nerve extending that goes all the way out to the outside of that tooth through something called a dentinal tubule. Every dentist knows about this. We were taught it year one in dental school. There's a mile of these little tiny tubules, these little tiny roads going off of that main canal. When they do a root canal, they clean the main superhighway out. They clean out the nerve, they clean out the blood vessels, disinfect it with bleach. That's actually the disinfectant of choice. Disinfect it with bleach, and then fill it up with a material called gutta percha. It's kind of this rubbery stuff. It's tree sap from a tree in Malaysia.
Huh.
So they fill it up with this rubbery stuff. That's what a root canal is. The problem is all that mile of little tiny side roads going off, they're too small to clean and they're too small to fill.
Mhm.
So dead tissue, dead blood vessel tissue and nerve tissue stays out in those little tiny channels, no matter what, no matter how well, no matter how meticulously well a root canal is done, there's going to be dead tissue in that tooth. So I liken this to, let's say somebody's been told they need their gallbladder out.
Mhm.
Well, what if they took your gallbladder out, cleaned it up, soaked it in bleach, filled it full of rubber stuff, and then put it back in your body? Would it work? No, because it's no longer connected to a blood supply, which means you can't get immune cells there, which means you can have no blood flow. The body will reject it and bacteria will find it. And that's what's happened to these teeth. Bacteria finds this dead tissue inside of the tooth. So now is where the problem arises because your body has to deal with that. Your
Mhm.
immune system has to deal with that. That low grade chronic inflammatory burden infection on the body 24/7 never ends, never stops, never goes away. So now your body's immune system is distracted and tired and worn out, and it can't deal with the other stuff that's going on. So I'm not saying that a root canal causes cancer. What I'm saying is that a root canal diminishes your ability to deal with everything else that your body naturally knows how to deal with. It
Mhm.
just can't do it anymore because it's worn out. Not only that, but the infection, it's like a piston. Every single time you bite on that tooth, you're forcing that infection, that bacteria into the bloodstream and around the body everywhere. They've now isolated it out of hearts. They've isolated it out of kidneys. They've isolated it out of colon cancer lesions, out of everywhere. These are bugs that are mouth bugs. Why are they
Wow.
there? Because they got sent all over the body at the ends of these failed root canals. And here's the kicker. You can't feel it because the
Huh.
nerve's gone. So you've lost your early warning system. You have no idea that it's reinfected until you get what's called a cone beam CT scan. This is a specialized dental x-ray where I can see everything in 3 dimensions. I can literally flip you upside down, turn you inside out, and see what's going on those root canals. And oh my gosh, you cannot believe what I find on a daily basis on these. I just saw 12 patients 2 days ago. Actually, was that just yesterday? Yesterday. Apparently, yesterday was a long day.
Right.
It's like it was 2 days ago. There was one woman in particular. It was just actually blew me away. She'd had 3 massive sinus surgeries. I mean, massive. Had just like whittled away all of the turbinates in her nose, cleaned out everything in sight. And no matter what, after she had the surgery, within about 3 months, infections would come back.
Mhm.
She went back to the ENT, and the ENT was like, I literally don't know what else to do for you. Like, I cannot take anything else out of your nose unless I just take your nose off your face. Like, I
Mhm.
don't know what else I'm going to do. And you can do another antibiotic. She'd been on like 15 at this point, it killed her gut because of it. And so finally she was like, well, I heard this lady talk about like maybe a root canal, came into the office, took a cone beam CT scan. She has a massive abscess on the end of an upper molar tooth. It had broken through the bottom of her sinus because anytime you have infection like that building, it needs a release valve.
Yeah.
And the bone on the bottom of the sinus is kind of like an eggshell. It's actually fairly thin. So it's either that bone or it's either come out the cheek side, which is a lot harder bone. So it's going to actually break through the bottom of the sinus first. So this tooth had been refilling her sinus after every single sinus surgery. And the ENT had never looked at the tooth to say, could this infection be because of her tooth?
Yeah.
It was just crazy to me. So
Yeah.
that tooth coming out and her sinus infections will go away. It's just there's so many direct correlates with failed root canals every single day.
Man, I can imagine why you get fired up about it. The reality that so few people ask about your dental health when they ask about your symptoms. It's just, I shouldn't be surprised by it. But yeah, that seems to be the way it goes in healthcare. And I watched the documentary Root Cause, which I think you and I talked about before, and it does such a great job of laying this out if the listener wants to go check it out. But one of the points they made was there's no such thing as an uninfected root canal. Like they all have it. And to your point, there's no other discipline in the entire world of what you could call healthcare where we leave dead tissue in the body and just put something in there that the immune system can't get to and think there's no consequence to that so we can save the tooth. And man, what a world. Anything else you want to say about root canals that we didn't cover?
It just leads to inflammation and infection, and then the body has to defend itself from it. So I had a patient who also had sky high cholesterol. She was doing everything she knew to get it down. Nothing worked. Finally, her doctor said, thankfully, you know what? Maybe it's your teeth. I don't know. There's crazy talk about maybe teeth can be related. Let's see. So she came in, had 3 root canal teeth removed. I saw her 3 months later because she brought her husband in for work, and she said, I've got to tell you the end of my story. She said, I got those 3 teeth out. I went back in a month later and got my blood tested. My cholesterol had dropped 90 points, and I had done nothing except get those teeth out. So cholesterol is your body's insulator.
Yeah.
It's your body saying something's not right here. And so I'm going to create more of it to insulate you more from it. So it's so important that we pay attention to the symptoms
Right.
because the symptoms are where the answers lie. Instead of taking a drug that will lower your cholesterol, that's now turned off the symptom
Yeah.
and left things just to get worse and worse and worse. So it's important. The most important thing is to go get that cone beam CT scan and determine, are those root canals healthy for you? And is it time just to get them removed? Because people will always ask, well, what do I do instead? So we remove and replace them with ceramic dental implants or a bridge or nothing. Sometimes people, it's the very back tooth and they say, I'm really fine without it. I really don't need it. Great. Let's get it out. Just take it out. But also people will say, well, what do you do instead? That's usually the biggest question I get. What do you do instead?
Mm-hmm.
And the answer is it depends on if the tooth is still alive. So if you still have a real sensitive tooth, a deep cavity, but you can feel that tooth still, what we do is we remove the cavity all the way to the deepest part, but leave the nerve alone. So we don't uncover it, don't get into that root canal area. Ozone right there to kill all the bugs. And then we fill over top of it and keep the tooth alive. So if you've been told you need a root canal, go get a second opinion. Go see if you can find somebody who does, it's called biomimetic dentistry. Basically, it's using ozone and fillings to save teeth and keep them alive. Once they're already dead, if you've got a big old fat cheek and it's swollen and it's already dead, replace and or remove and replace the tooth.
Yeah. Great perspective and amazing stories. I'm sure you got hundreds of them. But okay, what was the third category you were going to give us?
Airway.
Mm.
So this is all about air, and people think, well, why would a dentist talk to me about my sleeping or breathing or anything else?
Love it.
Because airway is largely structural.
Mm-hmm.
It's largely structural. And in our world today, most of us have a very small mouth.
Mm-hmm.
So if I meet anybody and they have had braces or they've had their wisdom teeth out, then their jaw did not grow adequately. Because if you look at skulls 300 years ago, they had straight teeth and they had all 32 teeth. They did not take their wisdom teeth out.
Mm-hmm.
Why? Well, the first bone affected by malnutrition is the top jaw. So, are we malnourished today?
Yes.
Exactly, because our food does not have the nutrients in it that it once did. So
Mm-hmm.
our food supply has drastically changed. So we might be getting, food, but it's not food with nutrients. So we are malnourished. And the first jaw or first bone affected, the top jaw, we get crooked teeth, we all end up with braces, and we all end up taking out 4 teeth because they don't fit in our mouths anymore. Well, if the teeth don't fit in your mouth, neither does all the tissue. That means the tongue, the soft palate, the uvula, all of that also has to fit inside of that mouth. And if it's small, it doesn't fit. So I liken this to like having a big, long, extended cab pickup truck and a teeny tiny garage.
Huh.
So you got this big old pickup truck in this teeny tiny garage, and so the back end of the truck spills out into the driveway. Well, the driveway is the airway. That's where air passes from your nose and mouth down to your lungs. So now you got the back end of the pickup truck out there. So it's blocking off what's supposed to be flowing past. And it's not that the pickup truck is wrong, like your tongue's not too big. It just can't fit in the teeny tiny mouth that you have.
Hmm.
So one of the very worst things I call it the ambient generation. It's this entire generation of people who had 4 teeth taken out for braces.
Hmm.
It was the easy way out. They went, oh, your teeth are crooked. Great, let's just take a few of them out. That way that there's enough room for all of the rest to fit. Well, you take teeth out, and what you've done is now permanently made the mouth too small.
Hmm.
Because you have to pull all the teeth together to close all the spaces. So they pull all the teeth together, and now there's no room for anything. So we have an entire generation of people, like 60 to 80% of people nowadays. I mean, it's so high, it's unbelievable. They can't fall asleep. They can't stay asleep. They wake up at 1 a.m. like wide awake, toss and turn for another hour or two. They are just not feeling refreshed when they wake up. They may feel like they slept, but they wake up and they're like, why do I feel like I just got run over by a truck? Like
Huh.
literally, why do I feel like this every single morning? It's about oxygen. If you
Yeah.
got that back end of the pickup truck hanging out into that where the oxygen's supposed to pass, you simply can't get enough oxygen. So what does your body do? These are the cool things because this is the stuff we look for. Your body clenches the teeth. Why? Clenching the teeth tightens up all the muscles in the airway. So this is why people clench their teeth at night.
Mm.
Wake up sometimes with headaches and sore things here, or I see it very often as worn teeth right here in the front.
Huh.
Because when you clench your teeth, it tightens up the muscles. And when you bring your bottom jaw forward, like this, teeth tip to tip, it brings the tongue forward and it makes more space for air to pass. So anytime I see worn teeth right here in the front, I'm like, oh, you don't sleep very well, do you? People are like, whoa, how did you know that?
Even for my teeth. What are we talking about? Yeah.
Exactly, because I see what your teeth, I see the accommodations or the adaptations your body is making to get more oxygen. It's bringing that bottom jaw forward, wearing your
Yeah.
teeth.
Yeah.
So the problem with this is when the body goes through sleep cycles, it goes through light sleep, deep sleep, REM sleep, and then back up to light sleep, deep sleep, REM sleep. REM sleep is defined by paralysis. No muscles can move. I've
Huh.
heard it hypothesized maybe it's so we don't act out our dreams, so we're not running around and whatever. So there's literal paralysis in REM sleep. If you engage a muscle, you're popped out of REM sleep immediately. Guess what clenching your teeth is? Engaging a muscle. Guess what bringing your bottom jaw forward is? Engaging a muscle. So if you are having to do these accommodations to breathe, you're never getting into that deepest level of restorative sleep.
Wow.
You might feel like you slept, but you feel like trash in the morning. You never really got the oxygen you needed. And oxygen fuels the energy production at every single cell of your body. So if you do not have oxygen, you do not have energy, period.
Yeah.
So we detect this on these cone beam CT scans. I can see what is hanging out into your airway. Is there room for you to get air? And if not, we make the mouth bigger again. We expand in adults and in kids. We try to get ahead of the game in kids. We go, oh, whoa, you don't have enough room. All right, let's start directing your growth. Let's make enough space in your mouth. We train the tongue to come up and forward. We have lasers that can shrink all the tissue in the back of the throat. Basically,
Yeah.
we get you breathing and living again. So that's the big piece that nobody knows is related to dentistry.
Man, no, I've been fortunate to meet some dentists who do, but you're right. You're such a unicorn in that industry, and it makes so much sense why we have so much of a sleep problem. But talk to the people who maybe like myself, who, the rite of passage we go through as teenagers now was just to have your wisdom teeth taken out. So in that scenario, is it still palate expansion? Is there any wisdom ever to having the wisdom teeth taken out, or is it always a disservice?
It's always based on the space.
Okay.
So still we have, kids we tell to get their wisdom teeth out because if the teeth don't have space to come in,
Hmm.
then they are potentially going to create issues in the future. And the longer the tooth's in the mouth, the harder the bone is, the further the roots go down to the nerve. And then if you have a problem, let's say you're 40 and now you've got a real big infection around that wisdom tooth, it's much more dangerous and risky to take a wisdom tooth out at 40 because the roots are longer, the bone is more dense, higher chance of nerve damage. So
Hmm.
that's why we say get it out when you're 18, 15, because the nerve is less dense, the roots aren't long, it's not going to damage your nerves. So we have to anticipate, is this going to create an issue in the rest of your life? Is there
Hmm.
space in here or is this going to create an issue? If it's going to create an issue, we're going to get them out. Preferably, I'm going to see you at 8. And I'm going to say, oh, your mouth's too small. There's not enough room for that, for teeth in there. Let's expand. Let's make more space. Let's get your tongue doing what it needs to do so that when you're 18, you got plenty of room for all those teeth. That's
Wow.
my preference for sure.
Okay. Gotcha. So if somebody's had them taken out, there's possibly still expansion that you do just because taking them out shrunk the mouth, and there's other benefits to having obviously better sleep and deeper air or
Yeah,
deeper
all of that.
oxygenation while you sleep. Yeah.
And also, a lot of those areas where the teeth were taken out don't heal properly. There's a ligament surrounding every tooth called the periodontal ligament, and it doesn't come out naturally with the tooth. So the tooth
Mm.
comes out, it doesn't just come out. And when we're removing wisdom tooth, we don't go back in and dig it out because there's like nerves down there and there's sinuses up there, like they're way back there.
Yeah.
So usually the ligament's left behind. When that happens for about 10 days, the body doesn't know that a tooth's gone yet because there's still the ligament there until the ligament necroses and dies. Then
Huh.
it's like, oh, wait, trouble, tooth's gone. Okay. But by those 10 days time, the gum tissue has grown over and down into where that bone should have grown. So you got
Hmm.
this dead ligament with tissue that's not bone. That dead zone creates all sorts of inflammation in the body. In fact, there's research that showed that it sends up all these are called cytokines. All these
Hmm.
cytokine flares telling the body, trouble, 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 trouble. This is a huge source of inflammation in the body. And we talk about, how that relates to chronic disease.
Yeah.
Huge source of inflammation in these dead zones in the jawbone. Again, we find them on cone beam CT scans. And when we find them, we have to go in, clean out that dead stuff, and fill them up with stem cells. I have the craziest stories with these, like a woman who had horrible eczema, could not get rid of it. Cleaned out these wisdom teeth areas, eczema 95% gone within a month. Just
Wow.
gone because it just dropped her inflammatory burden. Just boom, like that. Another lady who literally been bedridden, she'd had to move back in with her mother and was working from her bed, couldn't even hardly work. Got these cleaned out. The next morning, her mom found her up doing the dishes. She said, "What are you doing?" She's like, "I feel better than I felt in a decade." So it's just this huge inflammatory burden. And a lot of people say, "Well, I really haven't felt good since I was like in college." And I said, "Well, when did you get your wisdom teeth out?" College.
Yep. Light bulb just went on in that moment right there. Is that called a cavitation? Do I have that correctly?
Yep. That's called a
Okay.
cavitation. Well, that's kind of the old word. There's like a big long term for it now. I like to call them areas in the jawbone that didn't heal correctly.
Okay. That's a longer term. Yeah. But
That's a
very
long
technical. Yeah.
exactly. It just didn't heal. A place in
Yeah.
your jaw that didn't heal, There is like a fancier term even than that. But I just like to call it it's an area that didn't heal.
Yeah. It's like a scar in your mouth, essentially, that
Yeah.
is
Yeah.
somehow got a pocket of infection that is potentially explains so many of your symptoms. Okay.
Right. Yeah.
Okay. Okay. So I've got a few other questions, but you said 60 to 80% of health issues tend to stem from the mouth. What in your estimation is the other 20 to 40%?
It's a great question. A lot of things you deal with.
Yeah.
And it's the okay, we've got to get the huge burden off. So we've got to get the infection out that's spreading. We have to get your airway open so you can actually get air. Then we work with somebody exactly like you who says, okay, now let's do the hard work.
Yeah.
Getting everything out of the body, continuing to work there. Let's start adding good things to the body. Let's start eating the right fuel, eating the right things to give the body what it needs to actually get through those healing processes. So it's honestly the pieces, and no, sometimes we didn't talk about this, but there's actually a huge connection with each tooth connects to an organ system. And so, for example, hormonal issues are connected to wisdom teeth.
Hmm.
There's a direct line between hormones and the entire endocrine system and wisdom teeth. So we'll often see chronic fatigue. We'll have to see, some of these other hormonal issues, infertility. And
Hmm.
we'll go and look at these wisdom teeth areas and say, okay, is there that, dead zone in that spot? We get the dead zone cleaned up, but it doesn't balance the hormones automatically. Does that
Hmm.
make sense?
Yeah, it does.
So then we send to somebody who says, okay, now let's figure out, okay, we've gotten the burden or the root taken care of. Now let's work on fixing it. And a lot of times we're not the first place people arrive at because nobody thinks, I think my dentist is the one who should fix my chronic disease.
Right. Yeah.
We're like the 10th place that people arrive because they've done everything else right
I
and they
can,
still can't get there. And then
yes.
somebody says, maybe it's your teeth. And then they come and see us and we clear up, the major burden. And thankfully, they've already done all the work before they've gotten there, but they still have to keep then working to heal the body once that root cause is gone. So there's still work to do,
Mhm.
but the work works, if that makes sense.
Yes, it does. No, and I so resonate with I'm usually 10th on the list of things people will come to. And often I can identify root causes pretty quickly. Like, one, talk to a dentist. Let's figure out if there's anything going on in your mouth. Are you killing yourself with toxic thinking? Are you poisoning yourself with your food and water? Like,
Yep.
there's obvious flashing lights, and it's shocking most dentists or not dentists, most doctors don't answer or ask those questions. Like, we don't even think to look for root causes. It's just there's a whole host of symptoms. We can play symptom whack-a-mole indefinitely. And I love it that it's not surprising, I guess, talking to you, you eventually became a naturopath as well. You're like, okay, let me fix the first problem, and then I'm going to go fix all the others. I have the toolkit to fix the rest of it. What a great skill set to have in one person. Anything else you want to mention about what we've covered so far?
Nope. Just
Nope.
hopefully this inspires people to go and find somebody who can help provide this kind of care for them.
Yeah, yeah. Okay. Well, you brought up fluoride earlier, so let's that's a touchy one these days because a lot of states and municipalities are starting to ban it. Florida, I'm proud to say, has banned it from our municipal water system.
Yep.
So, what are your
Utah was
thoughts?
first, which is my state. Florida was second, which is yours.
Yes. All right, so we've got two winning states here. So what is
Exactly
give
right.
us your perspective on fluoride, obviously from a dentist perspective, but just fluoride in general.
Yep. So fluoride, the concept of it is awesome. And honestly, I am always of the positive intent mindset. Like, I don't really think anybody's out there to kill any of us. I really don't. Maybe there is, but I just don't go there. It's just not worth thinking that way. I usually figure out that we're trying our best. We're all doing our best with the information that we've been given, and we just need to keep learning. That's really the case with fluoride. So originally, they found that these pockets of people that were drinking well water that had higher levels of fluoride had more resistant teeth. They had stronger teeth. They also had splotchy teeth, like brown and white splotches on their teeth, but they didn't get cavities. So they looked at this and they said, "Oh, this is great. Let's figure out how to completely eradicate tooth decay. Let's put fluoride in toothpaste. Let's put fluoride in water. Let's put it everywhere so that we can get rid of cavities." So again, positive intent. We're trying to really fix something because people die from cavities, from abscessed teeth, and it's something, and there's just a huge inconvenience and cost and everything else. It would be fabulous to never have another cavity.
Mhm.
So this was the concept, this was the idea. But there's some big flaws that have really come to light as of late. The first flaw is, did it work?
Mm,
Has anyone gotten a cavity since 1930?
I think so.
I
Yes.
think so too. So it didn't necessarily meet the intended goal, right?
Right.
It didn't eradicate tooth decay. But the flip side is it did do a lot of other things that it actually wasn't intended to do. Because
Mm,
fluoride will strengthen teeth, no question. It'll strengthen teeth. But fluoride doesn't just stay put, especially when taken systemically, which is what happens when we drink it in our water.
yeah.
It doesn't just stay on your teeth. So what does fluoride do? Well, fluoride interferes with iodine, and iodine is what activates thyroid hormone. So in the 70s, fluoride was actually given to patients that had hyperthyroidism. Their
Mm,
thyroids were too active because they knew that fluoride decreased thyroid function.
I did not know that. That's
That's great.
crazy.
I
Yeah.
know. So now we're dosing it to every single person that drinks the water. So how many people do you know that have thyroid
Oh my
issues and
gosh.
low thyroid function? And how much of this could be related to fluoride usage? An enormous
Right.
portion of it. So
Yeah.
that's one problem. Fluoride changes the structure of bones because it actually makes teeth and bones stronger and more brittle. Well, that's a problem when you get to bones. So it changes the density and the structure of bones. So we've seen an increase in bone fractures due to
Huh.
fluoridation. The third thing it does is it affects brain health. There was a brand new study in January of this year that showed literally equal, if you increased fluoride this much, you decreased IQ in children this much.
Mm,
And it was specifically male children. So very, very neurotoxic, changing the way the brain is developing
yeah.
and working when you're using fluoride. So let's put all these two things together. Okay, it strengthens teeth. Did it eradicate tooth decay? No. It leads to all these other systemic health problems. So was it worth it?
No.
No, especially when there's another answer. And the answer is that teeth themselves are made of something called hydroxyapatite. It's the complex that you see when you smile. That's the mineral complex. Cavities aren't a deficiency of fluoride. They're
Right.
a deficiency of minerals. So instead of adding fluoride, which was never there and which will not stay put, let's just add minerals because guess what? Your body can use more minerals everywhere, not just your teeth. So there is no side effect, no harm whatsoever in just adding minerals back. So you need to be using hydroxyapatite tooth care products, toothpaste, mouthwash, tooth powder, all of the above to just put back what was lost to prevent or rebuild tooth decay, and it won't hurt you in any other way.
Oh, well, you set me up beautifully for my next question because you talked frequently about the idea of healing teeth and healing gums. I was excited to see. So we tend to think of those as not being able to be healed, but talk to me about you mentioned the minerals. What can people do who have gums or teeth that they want to see healed? Is it as simple as hydroxyapatite and getting more minerals, or are there other things that you would suggest?
Those are the biggies. Hydroxyapatite I call it minerals from the outside, minerals from the inside. So hydroxyapatite on the outside. And then on the inside, we use vitamin D3 and K2. Vitamin D3 grabs the minerals. Vitamin K2 puts them in the cell. So you can add a lot of minerals, but if you don't actually accompany it with those vitamins, you end up just calcifying a lot of things, like getting more tartar or kidney stones or gallstones, instead of putting the minerals where you need them in your teeth. So you need vitamin D3, K2, and then we have what's called a tooth and bone formula, but basically it's a mineral complex. So
Yeah.
minerals in, and minerals out. And that's the best thing to do. For gums, I actually have a really amazing mouthwash, just literally was released 2 days ago. I have an amazing mouthwash, but this one's a gum specific one. And what it does, a lot of people talk about the microbiome in
Uh-huh.
the gut, right? The gut microbiome.
Hmm.
Well, the mouth was part of the gut. It's the first part of the digestive tract.
Yeah.
And I like to think of it as different rooms in the house. So there's a room up here in the mouth that has certain bugs. There's a room in the stomach that has certain bugs. There's a room in the small intestine that has certain bugs, and another room in the large intestine that has certain bugs. There's like different bugs in each room.
Yeah.
And they all kind of have their own job and they're in that room for a reason. Well, we don't want to disrupt any of those bugs by trying to treat, one of the other rooms. So traditional mouthwash is high in alcohol. Well, alcohol is going to kill every bug.
Yep.
So if you're using Listerine, guess what you're doing? You're upsetting the microbiome in your mouth and in your stomach because it's going down there and it's going
Yeah.
to keep bugs down there too. So no alcohol containing mouthwashes for sure, for sure, for sure. So I have a new mouthwash that has colloidal silver that's used for the antimicrobial. Exactly. And what it does is it kills bad bugs, encourages good bugs. But I've added to this formula a prebiotic that's specifically formulated to do exactly that, encourage good microbial growth while killing bad bugs that damage your gums and your teeth. So this prebiotic was developed by a woman who's a dentist and a PhD. She's a research scientist, and she's independently lab tested this mouthwash, and she said this is literally the gold standard. Like this does everything you want for mouth health. So if you have gum problems, if you have tooth problems, this is going to help both. It's going to help rebuild your teeth and rebuild your gums with this prebiotic, the colloidal silver, hydroxyapatite, and it has some other herbals in there as well. And it just basically takes care of the mouth and keeps it well. That's really my purpose. And my whole goal is I don't want to see people once they're already so sick. I
Yeah.
want people to stay well and never have to get sick to begin with.
Yeah.
So from a dental standpoint as well, you don't ever have to get another cavity. You don't ever have to have gum disease. I tell people that all the time. I'm like, my goal for you is you never get another cavity. And they're like, oh, like that could happen. I said, no, it can happen. We're going to get you absorbing minerals like you should and taking care of the gums like you should. And you're never going to have another cavity. It's absolutely possible.
Wow. Well, I'm excited to get your new mouthwash. I've
Yeah, we'll
started
send you
using
some.
your other one. It's awesome. But now that you have a new one, I have
Exactly right.
FOMO. Like, I got to get this new one. So,
This one's even better for gums. I love it.
yeah.
It's
Okay.
an
Well, you
awesome
mentioned in your
way.
book, and that the book's a few years old, so I wanted to get an update. You mentioned there's a promising therapy for gums using stem cells and fibrin as a way to heal them. Did that mature and become what you thought it might be, or is that a
Not completely. And I believe it's because usually when using that, people still aren't getting to root cause. So
okay.
for gum recession, it often relates to that airway piece that I talked about.
Okay.
If you're not getting enough air, you're squeezing your teeth, you're rocking the teeth, and the flex zone. I like to like if you ever went to SeaWorld, there's like a splash zone, where
Yeah,
there's
yeah.
water that comes out. Well, there's a flex zone on the tooth too. When you're grinding or squeezing that tooth, it flexes the tooth. The gum sits right at the flex zone. So it moves down to find a solid non-flexing part of the tooth. So we get gum recession because of airway problems,
Hmm.
because of bite issues. So we can tack on some stem cells and things on the gums, but if we haven't addressed the reason that the recession is there to begin with, then whatever we've added is just going to recede again, if
Hmm.
that makes sense.
Yeah,
You
yeah, it does. No.
attack the reason that it happened to begin with. So those are the places I'm really focusing is let's fix all of these root cause pieces. Then we can create protocol for rebuilding once we fix that.
Okay. Got it. Well, fabulous update. Thank you for bringing me up to speed, and I like your logic on that one. Okay, so I guess if I'm trying to put myself in the shoes of the listener here, so maybe put your best bedside manner, or I guess in your case, the chair side manner, and maybe talk to a couple emotional issues I imagine people are maybe having related to the conversation. So first, last time you and I talked, I mentioned I did a consultation with a man who had a ridiculous number of fillings and root canals, and he was convinced of everything we're talking about today. But he was also convinced he couldn't do anything for his health until he saved $50,000 to get his teeth fixed. So, talk to the listener maybe about the expense or sticker shock sometimes of dental work, and what do you say to someone hearing this who's seeing the problem clearly, and they're perhaps feeling a little overwhelmed, thinking about, I don't know if I can ever afford this, or what is it going to take to disrupt my life? Help them through that emotional part of the journey.
So, two pieces. Number one, you don't have to do everything all at once. And I often will tell people, like they'll say, well, I have to save $50,000 because I have to be able to replace the teeth that I take out. If there's failed root canals, I have to be able to replace them. And I say, that's not true. What I want you to do is I want you to get into a holding pattern where nothing's getting worse.
Mm.
So I don't want anything going downhill. Maybe you can't replace everything right now. Maybe you can't get to perfect right now, but I don't want you going backward anymore. So what does that mean? That means you're going to start with infection. You're going
Mm.
to just start there and you got to get infection out because until you get infection out of the body's going to constantly be inflamed. You're going to have constantly depressed immune function and on and on and on, everything we've talked about today. So get infection out, period. If there is one mercury filling that's breaking your tooth and chronically leaking and leading to issues, start there. So it's all about meeting people where they are. If they can't do it all, then do one thing. Just start with one thing. But a lot of this goes to overwhelm as well. And I
Mhm.
talk to my team all the time and say, listen, somebody that's confused cannot make a decision.
Mm.
It's literal proven. This is like psychological thing. Like if
Right.
you have confusion, you can't make a decision because you can't be both of those things at the same time, decisive and confused. So we have to simplify it down. And that's where I'm always saying, especially when I'm meeting with patients, I'm saying, listen, step number one is this. I told you everything because we needed to think of it all in the context of everything, but I don't need you to do this all at once. I need you to do step number one, and this is the most important step, and this is what I would like you to start with right now. And this is it.
Hmm.
So that's really what I would encourage you to do is go ask the dentist, where do I start? I can only do one thing and be really upfront with them. This helps us as a dentist because sometimes we feel like we're shooting in the dark. Like
Uh,
I don't know if the person sitting across from me has the financial means to take care of $50,000 with a dentistry or if they have enough money to do $500 of dentistry. I
yeah.
don't know.
Yeah.
And so I can't really tailor that plan unless that information is shared. So if you as a patient, if you have financial limitations, it's not something to be embarrassed of. It's something that's actually very useful for us.
Mm.
Because if you come in and you say, I have $1,500 to spend, I say, great, let's figure out the most effective place for you to start that's going to give you the most for those dollars. And let's start there because even a little bit is going to get you closer to well. So that's when it comes to a dental perspective. When it comes to a wellness perspective, just to health in general,
Hmm.
that's actually what my new book is all about.
Mm.
Because what I've done is I've looked at all of the different options for medicine and wellness and health and everything in the whole world. And when I was sick myself, I was so overwhelmed
Mm.
and I couldn't make a decision.
Yeah.
I couldn't emotionally move forward because I didn't know. Everybody was telling me, you've got to eat like this, you've got to move like this, you've got to take this supplement. These are all one size fits all things, and that's not true.
Yeah.
So I studied all these different methodologies, and what I came up with is what I called a symptoms assessment. So you plug your symptoms into this assessment, and at the end, it tells you which place to start.
Mm.
Because really, like if you were to cut your finger and you put a band-aid on your finger, the band-aid doesn't do the healing.
Right.
Your body does the healing. So our job is simply to give your body what it needs to do its job. And all medicine, every single thing out there is just simply a band-aid. It's just there to support your job, your body in doing its healing. So our job is to give ourselves what they need. But how do we know that?
Yeah.
How do we interpret those symptoms? And that's what the assessment is that I've created inside of this is where do you start? Which cell needs help first? So let's say you plug in, I'm bloated, I've got digestive discomfort, I'm just like really ornery, I'm stuck, I can't seem to move forward in my job. Like you plug in these symptoms and it pops up. You are in a spring season and it's your liver and gallbladder that need help first.
Mm.
You go, okay, liver and gallbladder. So what do they need? All right, they need supplies, support, security, and signals. Those are the four things that I have in my cell well formula. Okay, what do they need supplies wise? They need greens. All right, you're going to start eating a green smoothie every morning. Okay, they need support. You're going to start dry brushing every day to just help your liver detox and dump stuff. So it's just a way to get your first step.
Well done. What a cool tool. I am eager to get your book and kind of digest that because that's a lot of what I try to do for people is I take the overwhelming mass of options and try to just call it down to like we don't have to fix everything today. Let's just where's the flashing red light? Sometimes it's dentistry, other times it's other things. And once you give them the path and to your point, you map out a journey and walk it out over time, so much easier to feel grounded as you go through a healing journey. You're not expecting it. That's good. Better be fixed in 2 weeks or it doesn't work. Like
Yeah.
healing takes time. So well
Yep.
done.
But not only does healing take time, we also need a motivation.
Mm.
And I believe you need to have a first step that's actually going to make some change.
Yeah.
That I believe is really important too. And so you have to have a large enough first step, not necessarily in effort, but in impact.
Yeah.
You need to have a large enough first step that you go, I feel that.
Yeah.
Okay, I'm going to keep doing this, you know? And so getting down to the cell that's giving, like putting, like you said, putting up the most red flags, figuring that out, that's really important because you can throw a lot of stuff at a lot of stuff, but unless you see the change, you're not going to stick with it. I joke that I have a supplement graveyard in my house. You know, where you get a supplement and you
Yep.
take it for a little while and then you forget why you were taking it. And then you think, I don't think it's really doing anything. And then you put the half bottle over in the cupboard and then, your supplement graveyard now grows. So that is the most humongous waste of everything, right? Waste of
Yes.
time, waste of expense, waste of hope, waste of
Mhm.
everything. So
Yes.
the steps you need to take need to make a difference. So
Yes.
that again is why the assessment is so important. It gets you to which cells need help first and what do they need first so that you
Yeah.
can see that there's a change.
So much wisdom in it. I can tell that's well honed and well earned because the coach, I deal with the brass tacks of habit formation and behavior change and all the places where we make excuses or our motivation fluctuations. And unless you can have some way to address those, there's your percentage of people you help goes way down. So
Yeah. Yeah.
love it that you took the time to write that book. All right. Go out and get the book. If you're listening to it ahead of the release, then be patient like me. But otherwise, go get it.
We'll be on
Okay.
next week.
Yeah, next week. We're almost there. All right. Second emotional puzzle I wanted you to just speak to a little bit is just talking people through the emotions of losing a tooth. And
Yeah.
this became personal because it's somebody I might be married to
Mhm.
wept when she realized that she needed to have a tooth pulled. There's just it's
Yeah.
not like, hey, life's moving forward and everything's getting better. It's just like a part of us has been lost or something. And so there's an emotional aversion or sense of loss sometimes that goes with that. So speak to the listener who's maybe just feeling the gut punch of I don't think I can get myself to do that.
Yeah. So there's actually another little, this is where people really start to roll their eyes at me, but this is it's a truth. So, teeth are crystals. They're crystalline in structure. That's the way that they're made. If you look at
Hmm.
the part you're looking at is a crystal. Crystals actually hold emotions.
Huh.
So we often are storing emotions in our teeth.
Wow, I hadn't thought of it as a teeth story. Okay, keep going.
Yep. And each tooth is connected to a different organ system. So a lot of times emotions that are connected to those organ systems are also going to be represented in those teeth. So yes, when you are contemplating losing a tooth, it can be an incredibly emotional thing, not just because you feel sometimes a little bit like a failure and
Mm-hmm.
like a loss and like, all of those feelings that none of us like to feel, disappointment, all of that, but also that there's stored emotions in those teeth themselves
Mm.
that don't really, I mean, you detox emotions all the time.
Yeah,
They
yeah,
don't go out nicely sometimes,
right.
you know? So there's a lot of things connected. As I discuss this with patients, I say when I was first doing dentistry, I was trained that my whole job is to save teeth.
Mm.
And that we were a failure, that as a dentist, we were a failure if we didn't save a tooth. And I look back on some of the things, and we jokingly in the profession call it herodontics, because we're doing something for a tooth and we know darn well it's not going to work,
Mm.
but we feel like we're going to be a hero for this person. We're going to do, I mean, I distinctly remember this one woman, and I just think back, I think there was no way that was going to be successful long term. I guarantee you that tooth is not in her head anymore. But
Mm.
I thought I was doing her a favor and doing every single thing I could possibly do. But now I've learned that all of those things I was doing were actually making people more ill because they were leading to harbored infection, these hidden infections that I didn't even know about. And I mean, I did hundreds of root canals myself before I learned this. This
Mm.
was a hard pill to swallow as a practitioner.
Yeah.
So now what I tell people is, you know what? I used to do everything in my power to save your tooth. Now I do everything in my power to save your health,
Mm.
even if it means losing and replacing a tooth. Because I can replace your teeth all day long, but I can't replace your health once it's gone.
Yeah.
So that is really the bottom line. And for patients as well, is to say, okay, this is part of a bigger whole. This is going to give me basically a new lease on life. And this is helping me get where I am going. It's going to take some time, and I'm not going to be thrilled with the process for sure, but I'm going to get there and I'm going to have more motivation, more health, more energy along the way so that every step's going to feel better than it does right now.
Yeah. And to let it metabolize, I'm worth the effort to do this, and my future is what's on the line here. And
Yep.
the impact I could have would be watered down by continuing to be infected and
Yeah.
not at my best. So
And I
Yeah.
love this concept of health span and lifespan. I talk a lot about this.
Hmm.
Lifespan is the length of our life, health span is the quality of our life. And
Yeah.
currently, right now, lifespan is hitting around 73 years on average in the US. It's decreasing. It has decreased every 2 years in the last 2 years.
Hmm.
So we're going in the wrong direction. Health span has also decreased. Right now, average health span is 61.9 years, meaning
Jeez.
after that, you will expect to have help being bathed, dressing, getting out of a chair. 61.9 years.
Well, that's
Hello?
so young. Golly.
Exactly. So what I'm saying is these kinds of things are the things that prolong your health span.
Mm.
Because what I want to do is if I'm going to live to 100, I want to be healthy until I'm 99.9, you know?
Right.
That's what I want. I want my health span to be as long as my lifespan. This is the kind of thing. These sorts of chronic infections are the things that take away your health span and
Yeah.
your lifespan, but your health span, which to me is almost even more important. Because if I'm not alive, well, I'm not really that concerned with my quality of life because I don't have life anymore.
Right.
While I'm alive, I want to be living my life. I want to be
Mhm.
living well.
Yeah. No, I often tell people death is inevitable, but I don't think disease is. We don't have to go that way. But we need to know what we don't know in order to shepherd our bodies through that and get to 99.9 and be like, okay, I think we're gonna
I think
this
I'm
may be
done.
it for me. Yeah, but I had a good run.
Yep.
Okay.
Yep.
Right. All right. Well, so various people I respect in this related to dentistry tell me to be very careful about who you listen to related to their advice. So obviously, I think you echo that. But what are some of the questions the average person could ask, or what would they look for to know they've found a dentist who gets what you're talking about?
So main things you're going to ask are, what are your beliefs on fluoride?
There
It's
you
going to
go.
give you a real good indicator right off the bat. What's their philosophy? What are your thoughts on root canals? Do you have a cone beam CT scan machine in your office? That tells you again, are they looking for root cause? What are your thoughts about metals in the mouth? So these are all questions you're just going to ask right off the bat. And these are things that I have on my website that I tell people, these are the questions you want to ask. Fluoride, root canals, metals, cone beam CT scan. Those are the biggies. What are your thoughts on that? And that'll give you a real good clue on what's their philosophy of care.
Okay. And if they answer with what was the acronym you said for effective metal cleanup that's not putting you at risk, that would
Oh,
be
smart. Yeah,
smart.
smart. Yep, safe mercury amalgam removal technique is what that stands for. Yeah, smart. It's through the IAOMT. They're an organization that you can look up. Again, there's a lot of dentists on that directory. So go check out their directory, IAOMT.org, and my directory on my website as well, livingwellwithdrmichelle.com, because those are dentists that have already shown that they are sharing in these philosophical beliefs.
On. Okay, I love it. So it's when I get interviewed, I am often asked, "So, what do you eat for breakfast?" Or "Give me your morning routine." So, tell us, Dr. Jorgensen, what is your oral care routine?
Yep. So what I do is I use all of my products. Why? Because they actually work. In fact, I am like patient number one. So I have used my tooth powder longer than anyone else because it was made in my kitchen. I'm currently using my new toothpaste. I am also patient zero, actually patient zero for toothpaste. It should be out in the next month. All of these things, mouthwash. I currently am patient zero with the new mouthwash. I was the first one to get it. So I use all of these things before I give them to you because I want to make sure they actually work. So hydroxyapatite tooth care products. I love an electric toothbrush because you can use it even when you're lazy, right?
Uh-huh.
Put it in there and it's doing the work for you.
Yeah.
Because I see too many people, their mouths get full of foam. This is why my products don't foam also, because when your mouth gets full of foam, you think you're done. You think you're clean, even though you've only brushed like a third of your teeth.
Mm.
No, you have to brush them all. But so you use a toothbrush. I like an electric toothbrush. You're going to brush your teeth. You're going to tongue scrape. Why? Because the tongue is where a lot of yeasts live. So
Mm.
if you have issues with yeast problems, which is often sinus infections, chronic sinus infections, sore tongues, and yeast infections elsewhere in the body, those are often related to tongue scraping. So I'm going to tongue scrape and then I'm going to mouthwash.
And you
So
have a copper tongue scraper, so tell people why you have a copper one.
because copper is antimicrobial. So when you're scraping bugs off. So they're going to stay living on that tongue scraper. So when you go and tongue scrape again tomorrow, you're going to basically reintroduce those bugs to your mouth that you just scraped off yesterday, unless you use one that's antimicrobial that doesn't allow bugs to grow on it.
Nice. Okay. So tongue scraper, use your toothpaste, tooth powder, electric toothbrush. Anything else you tell people that would be a non-negotiable or don't miss this? Yeah, you have a unique floss as well. I don't know if you want to mention
Yeah.
that.
Yeah. So it's actually interesting. This is a little known fact. I don't floss.
Ah, Tell man, ever this and half of the listeners rejoice, or most of them just did. Yeah.
Exactly. I actually don't floss. And the reason I don't floss is I don't have a lot of dental restorations. I've actually never had a cavity. So I'm, I'm bad. So I've never had cavity, but I don't have a lot of dental restorations. And so my gums fit quite tightly to my teeth. I actually don't get my teeth cleaned very often. My team knows this. They're like, okay, is this like, your 7-year plan here? What's going on? I'm like, well, I don't actually have anything to clean off my teeth. So if you have dental restorations, you're going to need to floss. Why? Or you're going to need to use a water pick or something to get into there because you have nooks and crannies that are hard to clean.
Hmm.
If you don't have fillings on teeth, the gums fit quite tightly against the tooth. And when you floss, you actually are opening up more of a gap
Hmm.
between the gum and the tooth, and you may be introducing more problems than you're solving. So it's not a one size all fits solution because if you have dental work, if you have fillings, crowns, whatever, you've got to get those cleaned. You've got to get around them. Things have already changed in your mouth. But if you don't have fillings on teeth, you may actually not need to floss them because we want those gums to stay nice and tight against the tooth to protect the tooth. So, yeah, you got the deep stuff today.
No kidding. Well, and tell people what's unique about your floss. It's black and it has a little bit different texture. What's special
Yeah,
about the floss you do have?
it's bamboo charcoal. And what it does is it is woven. So as you floss down between the teeth, it's going to grab bacteria and hold on to them and take them out. The charcoal actually is a binder. So like if you were to swallow a bottle of Drano and you were sent to the
No.
hospital and they were going to pump your stomach, they're going to fill it up with charcoal. Why? Because charcoal's a binder. And in fact, you may use it for
Yeah,
detoxing.
yeah, we do.
So charcoal's a great binder. So it's also going to grab to bacteria and anything that's like living in between the teeth and just hold it and take it out. But a trick when you're flossing, get enough floss that you can actually move down the floss while you're flossing. So you don't use the exact same portion. Otherwise, what you're doing is you're cleaning the bugs out of one spot and moving them to the next spot because they're still on that floss. So you want a long enough piece of floss so that you're using the first end, moving it, moving along, use the next piece, move it along, use the next piece, so that you're not just reintroducing bugs from one part of the mouth to the other part of the mouth.
Dang, I wouldn't have even thought of that. I'm so glad I asked. And then your toothbrushes that you sell are wooden. I'm like, of course. Like, why would we put plastic in our mouth and just slowly whittle that away so we can have another source of plastics in our
Exactly.
body?
Exactly. And in the landfill and everywhere else,
Yeah,
so yeah.
yeah.
Yep. So everything's biodegradable.
Okay, cool. Anything else about your products that you want to mention? Obviously, there are books there, but you have like video courses, you have yoga mats, you've got deodorant, you've got so many things. Are there other favorites you have or things you want to highlight about your product line?
Really, it's all just things that I found a lack in the market for.
Hmm.
Things that I personally wanted, and everything that I formulate actually is formulated in my kitchen. People are like, really? Yep.
Wow.
Literally is. I'm a cook and I'm a scientist. And so you put those two things together and you make stuff in your kitchen. So my family will come in and I'm like, hey, 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 try this, try this. They're like, please no, please don't make me try. I'm like, no, try it. This one tastes good, I promise.
Right.
So so I make everything myself. Like I said, I'm patient zero for everything. So all the products are personally tested, personally formulated. They're just things that I couldn't find. So I decided to make them. And that's where my next mission is now happening and going. So I have interesting story. I just shared this on social media yesterday for the first time. 5 years ago, I was told that I had a personal mission and I would be starting it December of 2025. And in my church, a mission is a thing. You like leave for 12 months, 18 months, you go serve, you go do all this. And so that's what I thought I'd be doing. And so I've been doing everything to mentor doctors, handpick my partner, doing all these things for 5 years, 4.5 years now, getting ready for this place. And finally, I've realized what this mission is going to be. I'm actually going to retrace Dr. Weston Price's footsteps. If you're in nutrition, you know him.
I totally know him.
He was
Yes.
a dentist. Not a lot of people know this, but he has really shaped nutrition since he lived 85 years ago, went and did his research 85 years ago. He
Yeah.
shaped the nutritional landscape since that time. No one's really gone back and said, this is what he learned then. What about now?
Yeah.
Are these people still, wow, what has changed? What has changed? So I'm going to go back and retrace his steps and show us what is happening in those areas and bring it back and simplify it down to here's how we can stay well. So it might be that there's new products coming, that there's new things that we're going to be bringing, but they're all from the earth. This is from the elements of the earth. This is from what the earth provides for us, just taking us back to the way our grandmas used to stay well. How did they stay well? And how can we bring that back? Because we're going the wrong way in the world today. and we need to turn the boat around and go the opposite direction and actually learn how to stay well. So, lots on the horizon. Please check out my social channels. There's so much free stuff on there. I just talk about cool things all the time.
Yes.
So
Yes,
come on and learn.
she does.
Today I was just talking about how I was building this cob dirt and clay pizza oven in my backyard and using cow manure as the plaster on it. I mean, just like weird cool stuff all the time. So just come and follow along, because my whole purpose, my whole mission is to help you all live well so that you can live your mission.
Man, well said. And I was when I was reading your book, I got through the parts about the fillings and the root canals, and then you start talking about nutrition. I'm like, oh, she gets it. There's a whole section on Weston A. Price and on how to make your foods digestible. I'm like, oh, like so many dentists, they put you in like you just have to eat plants, or there's so many different nutritional holes in the way they tell you to eat. I'm like, ah, but to find you and to find we were in alignment on our nutrition philosophy, and you understood holistic health, and you were becoming a naturopath, and you're looking at dentistry, and you got a boldness to call it out. I can just feel the mission that oozes out of you, and just I'm honored to know you. I'm honored to amplify your message and direct people to your products. We'll have even a coupon code in the show notes. You can get
Yep.
discount on our products. So, all right. Anything else you want to let the listener know as we start to wrap up? Is there, you obviously mentioned the Find a Dentist link. Maybe give them your social handles or your website one more time.
Yep, livingwellwithdrmichelle.com. And please go and purchase the book. It's not for me, actually. All profits from the book are going to charity. We're going to be supporting regenerative agriculture, clean water initiatives, all the things that are going to help us all live well. So this is not padding my pocketbook. What it's doing is it's helping us all to live well better in the world. And it's telling booksellers and publishers that these are the kind of books we're all interested in. The more of this book that sells, the more of these kinds of books they will support. So go buy the book. It should hopefully be out by the time this is coming out. And then go back onto my site, livingwellbook.com, and get the assessment, the digital assessment that I've been talking about. Go get it for free, as well as your first steps guide. It's all just there to help you live well.
Wow. All right. Well, you are a gem and a gift to humanity. Thank you so much. I don't know how many people's lives may have been saved just from this one episode. But on behalf of the listener, thank you for taking the time. I so appreciate it and look forward to talking to you in the future.
Thank you so much.
Thanks for listening to Deconstructing Conventional. If this conversation sparked new questions or helped you see things in a new light, feel free to share it with a friend who is on a similar journey. Don't forget to subscribe so you never miss an episode and a perspective that challenges the norm. Check us out on our website at healingunited.today and find us on social media at Healing United, or you can check out the Healing United PMA app. It's a great way to stay connected. Remember, question everything and rebuild intentionally.